Hello, Diaz here, founder and owner of Greenwood Dental. Thank you for joining me again. Today, by request, I am talking about or answering a question regarding autistic children or autistic patients. I have been asked many times, and I think it's time for me to talk about our services towards the condition of autism and how we service autistic patients, autistic children in our office. So to answer your question, yes, we do see and service autistic patients. Through my 22 years of career, I have seen many different types of autism, many different degrees of autism. I'm not going to bore you with the statistics or research. As you know, these videos are all about my observational data, and whether you find my observational data is helpful enough for you guys to take the next step for a better oral health. So autistic children, they are diagnosed very early in the early childhood stages. Many patients are not being placed with dental services. Parents obviously go through very challenging times trying to care for them physically, but also on top of that, as you know, the physical and the dental are connected. So if you happen to be watching this video and you know of any child or patient that is severely autistic and needs dental care or any dental services, please feel free to contact us and send them our way. We'll be very, very happy and glad to help them out. I have treated autistic verbal and autistic nonverbal patients and children. The nonverbal obviously is very challenging, and you have to train your team how to approach a nonverbal autistic child or nonverbal autistic patient. With my experience, a couple of things needs to happen during the visit. The pre-intake, the information intake that we do prior to their visit, it's very important to understand their lifestyle, understand their communication skills, understand their habits, understand what works and what doesn't during their daily life. That's very important so we can customize the experience to that specific patient, that specific child. Some children are bound to their strollers when they come in because they are very sensory sensitive, and parents feel more comfortable keeping them in the stroller than putting them in the chair. Otherwise, the environment might trigger a episode of uncooperative episode. One of the things that I learned from previous years in collaborating with therapists is lead apron. One of the things that we use, if the child is willing to, or the patient is willing to sit in a demo chair, is to put a lead apron. Lead apron will ground them and will help them turn off the hyperactive sensory challenges that they have. Sometimes we'll double lead them too, because if you talk to parents, we found out that a lot of these children have a weighted-in blankets that use at home to help them sleep and calm down. That works very, very well if the child is willing to move from the stroller into the chair and sit by themselves. Then we can place the lead apron on them. So that's one of the things we do. The other things, collecting records like x-rays. We have a panoramic x-ray. They love that because, again, it will cape them with the lead apron, and they only have to stand, and the machine that goes around the head to take a panoramic x-rays, the software of the panoramic machine that we have, we can actually pull smaller x-rays so we can diagnose with those. So that's another thing we do. The third thing we do is we are trained or retrain our hygienists to work very, very fast to focus on the oral challenges, the main oral challenges that the parents have with the child or with the patient, whether lack of brushing or pain or discomfort. Remember, severely autistic patients, severely autistic children, they cannot communicate sometimes. So if they have a dental challenge or they have an oral health condition, they won't be able to communicate, but the parents or the care provider will notice that the child is not eating the same way, they're not behaving the same way, and something is wrong. So for us, we'll be very happy to have you guys come in and for us to navigate through that, and we'll be able to figure that out. Now, if the patient or if the child requires extensive dental work, which honestly and surprisingly through my years, autistic children orally are very healthy. Which is a great thing, then it does not require us to refer them to an oral surgeon to be sedated under a hospital condition or hospital environment in order for us to get the work done. So basic re-care services, especially in our facility, and I can speak for Greenwood Dental Partners, we are very well equipped and we're very well trained to care for those patients for 6 months routine checkups and evaluation and care. So I hope that helps, and I hope that you guys feel comfortable reaching out to us. Even if they're in a wheelchair, that's fine. Our chairs are actually designed to swivel around the headrest, and we can use the headrest of the chair and keep the patient or the child, just like any elderly or disabled patient, to care for them. So I hope that helps answer some of your concerns, some of your questions regarding servicing autistic patients and autistic children. They are a joy. They are very grateful. They're so happy to leave after the fact. Some of them have great sense of humor, and it's just something that we love to give back to the community with all the support and after all the support that we get from our patients. So I hope that helped, and I hope that just gives you an idea of the process so you guys are not nervous or then you're not uncomfortable bringing a loved one that is autistic to our offices or our dental clinics. And we wish you well. So we love you, be safe, and DS out.